coming to our newest Lunch and Learn. Natalie will keep us posted on lunch, so we'll keep on that. But this month is Atrial Fibrillation Awareness Month, so we're going to try to do these with the month, every now and then with a month that, we're trying to be aware of. So this one is atrial fibrillation. Has anybody ever heard of it? Heard of it? Raise your hand. Like, okay. Have you ever seen a commercial for maybe a drug or, something like that? Does anybody know what it is? People, besides personal experience. Honestly, like if you're like, I don't know. Okay, well that's good. So we're gonna just do like a basic learning experience of it so that you can go and tell your friends and family, hey, it's Atrial Fibrillation Month and this is what it is. There it is. Okay, sorry. Okay, so purpose of this presentation is to basically learn about what atrial fibrillation is. You'll hear me say AFib. That's a much easier way to say it all the time. Recognize the symptoms and possibly how to prevent it, and then bring awareness to others about AFib. Okay. All right. So some of our learning objectives are: what is it and what causes it? Some signs and symptoms that you want to be aware of. Who's affected by it? Now, we're going to talk about the general population. There are exceptions to the rule. Some treatments for it, and then how to try to prevent AFib, okay, down the line. Okay, so just a tiny bit of background. AFib was first observed back in 1874. Like, they first figured out, like, this is weird. There was a first recording of it, was in 1876, a couple of years later, and then the first EKG, which is, the paper, the lines that we do, was in 1906. So people have known about AFib for a long time, okay? And it says, yes, but what is it? Okay, so the definition. It is an irregular heartbeat caused by a faulty electrical system of the heart. Okay, so your heart, just like anything that runs on electricity or has an electrical signal, your heart has one too, okay? If the electrical signal is faulty, nothing else is going to work right after that, okay? The atrium of the heart, and I believe I have a picture of the heart, so you'll see this in picture form, will quiver. It'll kind of shake around, because our heart is supposed to squeeze the blood and then let it go and squeeze the blood. Well, when you have AFib, the top two chambers of your heart just kind of wiggle and they don't squeeze. They just kind of vibrate. This can lead to blood clots, a stroke, or eventually heart failure. And an EKG and an echocardiogram can diagnose AFib very easily. Okay? It's not like you have to go through a CAT scan or anything like that. So this is your heart. Okay? So this is the EKG and an echo will diagnose AFib. Very easy. So if you have never seen your heart before in an anatomical picture, you have a 4-chambered heart, 2 atrium on the top, there's one on the right, one on the left, and then on the bottom they call them ventricles, one on the right, one on the left. And then up here in the top corner is called a sinus node. That's the beginning of the electrical system of your heart. Everything should start there, and then the signal goes down to the rest of the heart, telling it beat, okay? In AFib, this is kind of messed up. The whole beginning part of the electrical signal gets kind of messed up, okay? So that's what the problem is. So, a little video here, and it'll explain it really well. Hopefully the volume's up.
On the right. I don't know if it'll play with it.
Your heart is a muscular organ which lies in the center of your chest. Your heartbeat is controlled by electrical impulses, which travel across the heart, making it contract. The atria contract first, sending blood into the ventricles. The ventricles then contract, sending blood into the lungs and around the body. Nerves supplying the heart change the rate at which impulses are sent across the heart muscle to meet the needs of the body. In atrial fibrillation, The electrical impulses in
everything.
the atrium become disorganized, overriding the heart's normal rate and rhythm. This causes the atria to quiver or fibrillate. The irregular impulses can be transmitted to the ventricles, causing the heart to pump irregularly and too fast.
So you see how normally all the four chambers work together? One squeeze. In AFib, the top ones kind of go blah, 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 and then it makes the bottom go blah, 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 blah. So that's why the blood kind of just pools in the heart instead of being squeezed to where it needs to go. That's why you get blood clots, okay? Everybody okay so far? We're good? Oh, is this yours? Oh, this is that. All right, sorry about that. Oopsie. There we go. It kind of clicked off of it. There we go. Sorry, my bad. Okay, so signs and symptoms. Now, signs and symptoms are very important when it comes to AFib. Usually, most people have a fast or a rapid heartbeat, you know. They may experience a skipping of the heart or feel like it's racing at one time and then it's not, and then it's fluttering. You may be overall very weak. You may have a general fatigue where you're like, why am I so tired? Dizziness, shortness of breath, chest pain may be involved, sweating, just like, why am I sweating? Or you can have nothing. That's the only bad part about it. Okay, usually you feel something. Usually there's something that's telling me I'm not feeling well. Okay. Who AFib affects? Now these are typical. Okay. First and foremost, it's usually going to be someone of increased age. Okay. Most of our AFibbers we see 70, 75, 80. Older. Because the heart is just kind of wearing down. It's a normal age progression. But someone who also has uncontrolled hypertension, high blood pressure, anybody maybe with an underlying cardiac disease, heavy drinking, maybe you have a family history of heart disease, or grandma had AFib and mom got AFib. You have that in family. Sometimes people with sleep apnea can get AFib. Any kind of chronic conditions, diabetes, thyroid, asthma, can also play effect on the heart. And sometimes even athletes get it. So it doesn't necessarily mean oh, I'm out of shape. Sometimes athletes have it too. These are relatively norms. Now, it doesn't mean that someone who's very young can't get it for whatever reason, or something outside of this. Okay, so these are my infamous Italian grandparents that I went to go stay with in New York. My lovely grandparents. But I put them up here because they fit the norm, okay? He's 89, she's 88. Okay, they both have high blood pressure. Granted, it's controlled, but they both have high blood pressure. He's got diabetes, she's got high cholesterol. Now, his AFib comes and goes whenever the heck it wants to. Hers is pretty permanent, so she's not coming out of it, okay? But both of them are on medication to control it. So AFib can do whatever it wants to do. Okay, so this is really tiny, I'm very sorry, but this actually is one of our case studies of a patient that we have tested here, okay? It was a 58-year-old female, clearance, one of our bariatric patients. She was coming in to do her bariatric procedure, and basically we saw that she had AFib. And with us, with Frontera, we've got a couple of guidelines with testing AFib. If somebody walks in the door and we say, oh, ma'am, do you know you have this condition? And they go, huh? Then we call it new AFib. And then we say, we need to make sure you're safe before we test you. And we usually send them off to a cardiologist first, okay? If somebody walks in the door, maybe it's our 75-year-old guy. He goes, I've been on AFib meds for 20 years. Oh, yeah. And everything's super controlled. We'll probably end up testing that patient. So AFib is kind of funny that way. In this particular case, I think AFib was new. She had a very fast heartbeat, and her ejection fraction on her echo was quite low. So meaning that it wasn't squeezing well. So we shipped her off to cardiologist on this one. And I believe you can see her. This is the EKG. This is her resting EKG. If you can see between these points here, between all these points, it's very irregular, and sometimes in between you have what looks like a bunch of scratchy, squiggly lines. And you're like, huh? It's not regular. The heart rate is not regular. The electrical system is not regular, so that's why you'll get like a beat and then like a scratchy line and then a beat and then some more scratchy lines. Okay, and that's very typical of AFib. And a lot of times with AFib, because the chambers are all off, the heart rate will go from being very slow to sometimes very fast. Sometimes it'll stay very fast. And like in the case of my grandmother, her heart rate was like in the 130s, 140s. And I mean, at 88 years old, they were like, you're gonna have a stroke. So I mean, they sent her right to the hospital, and sometimes, that's a real problem besides the blood clots. Okay, so what can they do about it? The easiest thing to do is to give medications, okay? Lots of people live with AFib every day and they just are on certain medications. If it doesn't go away, that's okay, but if it's well under control, you're pretty fine, okay? Medications are going to control the heart rate. Sometimes they're going to control the rhythm, and they're going to be there for clot prevention because we do not want to have blood clots, okay? Some examples of medications that they can give are called beta blockers. They use that sometimes for high blood pressure, but what it does is it slows the heart rate down so that the heart's not all over the place. We want to slow it down. Sometimes they give something called digoxin or digitalis. That also will help control the rate. Warfarin, you might have seen commercials for Xarelto or Eliquis, Pradaxa, all these new drugs. These are all blood thinners, okay? These are all kind of things they want to give to prevent clots, okay? Or sometimes we've seen some patients where maybe they couldn't afford these medications. Their doctor will put them on, what's another medicine, if anyone's ever taken it, that if you're going into surgery, they go, please stop this, otherwise you're going to bleed. Aspirin, exactly. If you're on a bunch of aspirin, that will also act as a very good blood thinner, good for AFib, not good for going to surgery. So, sometimes patients can't afford Xarelto, doctor will say, take a whole bunch of aspirin. If these don't work, sometimes they'll do cardiac procedures, like in a cath lab, they'll do like an ablation, which means they go in with a catheter and a little like kind of cauterizing tool, and they go, and they try to like zap out the area that's irritable, okay? Sometimes they can do that, but with AFib, sometimes you've got multiple areas of the heart that are irritable, and it's real hard to be like, zip, 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 you zip the whole heart. Other times what they do is they call cardioversion, and cardioversion, basically, if you ever seen somebody be defibrillated, like they're clear, and that's exactly what they do. They restart the heart, okay? I think you're awake. So you can do that. They can try that too, and sometimes that shock to the heart will reset it, and the AFib will go away, sometimes. Other times, you may need full-on surgery, and what they're going to do is they're going to give that person a pacemaker, okay? It's a little device that they put under their skin and into the heart, and it basically tells the heart, okay, B, you're gonna, because its own electrical system isn't working so well, okay? All right, living with or prevention of. What can I do? Can AFib go away? Yes, it totally can go away. Some people have one episode of it, and then it's gone. Some people, it never goes away. What do I do if it doesn't? Well, then you obviously, if they give you meds, you stay on your meds. Or how can I try to prevent getting it? Well, first things first, get the other conditions you may have under control. If you have high cholesterol, try to get that under control. Your medication, diet, whatever. Same thing with your blood pressure. If it's uncontrolled, see how you can get it under control. Sleep apnea. If you know you have sleep apnea and your doctor's been saying, hey, you gotta get that machine, hey, go get that taken care of, okay? Maintain a healthy weight. Don't smoke. Try to eat a healthy diet. Limit your alcohol, definitely. Exercise. Take your meds, and then continue to follow up with your doctor. Just because you're like, oh, I got my meds, I don't have to go again. No, you got to follow up with your doctor. Just like with any kind of chronic condition you may have, they're going to keep an eye on you. Okay, so you want me to do this first? Okay, so you guys have been doing this kind of as you follow along, but this is the official quiz that we'll go through, and then Natalie's going to show you the echocardiogram part of it. Okay, so first of all, Atrial fibrillation is an irregular heartbeat caused by a faulty electrical system. You got it. The atria of the heart, what do?
Quiver.
They quiver, right, instead of squeezing. Untreated AFib can lead to 3 pretty important things.
Blood clot, stroke, and failure.
Good job, right. A blank and a blank can diagnose AFib.
EKG and echocardiogram.
Exactly. So 2 very kind of inexpensive, tests that you can go have mostly at your doctor's office, or we can come and do them, and not have to do like a CAT scan or PET scan or whatever. 2 signs or symptoms. Now there's a bunch of them, but somebody raise their hand and tell me if they've got one.
Dizziness.
Dizziness, yeah. Give me another one.
Yes.
Rapid heartbeat, weakness. What's another?
Sweating.
Sweating, yes. Like not just like, ooh, half, like sweating. What else? Skipping a beat, right? Now, don't get confused, because some people, we all can naturally have like a skipped beat every now and then to the heart, and they'll be like, oh my gosh, I got AFib. It's more like, why is my heart going real fast? And then like it's slow, and then, it's very erratic. Yeah, it's not just like a one-time thing. Yeah. Good. All right, so let's move on to the next slide. Okay, AFib can affect people who, what, anybody? Raise your hand if you got an idea. Who can they affect?
Increased age.
Increased age, right, the elderly. Who else? Right, uncontrolled, other kind of problems, right? Sometimes even athletes. What else? Who else?
Family history.
Family history.
Sleep apnea.
Uncontrolled sleep apnea, right? Yep. Well, yes, or somebody who may drink a little too much. All right, treatments for AFib can include what?
Meds, cardiac procedures, and surgeries.
Right, so when we talk about meds, what's one medication that somebody could be put on?
Beta blockers.
Beta blocker, right? What else? Warfarin, aspirin, right, those are called blood thinners. So now when we test a patient here, okay, really the one medication that we're always going to ask for is, are they on a blood thinner? Like even above that beta blocker. Because sometimes you could be in AFib, but your heart rate isn't real fast, so I don't need a beta blocker. But most of the time, if you are in persistent AFib, you have to be on some sort of blood thinner because you're always at risk for throwing a blood clot. That's their problem. Doctor's going to accompany it. In the case of my grandmother, she's on all of the above. Digitalis, she's on Xarelto, and the problem is that if you felt fatigued with the AFib, sometimes the meds, because they put you on so many, you're like, I'm so tired. So it's hard to tell, if your symptoms have changed at all. Can someone live with AFib?
Yes.
Totally. Yes, you totally can. And then 3 things that you can do to keep either your AFib under control or try to prevent it.
Stay on meds. Control other symptoms.
Right? Exercise. Right. Everything that pretty much is going to help you with any other condition that you may have. Right. Just keep your health in check. Go to your doctor regularly. Follow up with it. Keep an eye on it. Good job, guys. Does anybody know of anybody who has AFib?
Would yourself count?
Yeah. I mean, would you like to share your story, or do you have it anymore?
No, they did surgery to fix it. They did the ablation.
Right. Yeah.
But it was tachycardia that I was getting that.
Right. And sometimes, AFib can come from something else, but yeah. So in her case, she had the surgery to just knock it out. Is it back? It's gone?
Mm-hmm.
Right. And so now do you have to be on any medication for it? Right.
Well, I'm supposed to take aspirin once a day, but
Like a baby aspirin?
yeah.
Okay.
I
Yeah.
don't, so.
Nothing heavy duty.
Isn't it interesting that she was only 19 when that happened?
Yeah, exactly. So I mean, like, she falls totally out of the norm. You're not eating on, but for some other reason it happens. But so same thing applies though.
Yeah.
Actually caused me to have a heart attack.
Oh, yeah.
Mild heart attack.
All right. So Natalie's gonna take over and show you about the echo side of it.
So Maria has pretty much covered what it is, symptoms of it, ways to treat it. An EKG really is needed to confirm AFib. On an echocardiogram, there's a few ways you can think a person has AFib and kind of confirm it with the Doppler that's shown here. But it's best to have an EKG done as well, just to confirm that the person actually has an atrial fibrillation. Because we can tell us with using the Doppler waveforms, a normal patient has an E and A wave whenever they're doing the pulse waves through the mitral valve, where a person with that's an atrial fibrillation, you're only going to have an E wave. So that's the first indication. Also, it's very hard to get a good ejection fraction because the heart, like Maria said, is kind of not pumping as it should. It's not all squeezing together. It's kind of moving, in synchrony ways. So it's kind of hard for the physicians to give a good ejection fraction. So on the next slide, I'll just show you, which is clips. I was having trouble getting it to loop very long, but you can kind of just see the heart. First of all, is going very fast, 154 beats per minute.
Mhm.
But this is the same patient down here that this case study was done on. The heart rate is just increased on both of these patients. 154 on one and 190 is what's actually recording on the machine on the other patient. I don't know if that's the actual heart rate once the patient got to the EKG to have the EKG done. But so those are just a few ways we can tell on the ultrasound that it looks like the patient's in atrial fibrillation. Let's see. Then I wanted to share this story of, like Maria said, the main issue with atrial fibrillation is that it can cause you to have blood clots, which then ends up causing a stroke, a possible stroke. And your prime example of how it can happen to anyone at any age. Some people don't even know they have it until they have a stroke or something detrimental happens. So I'm just going to share this story. Hopefully it's loud enough.
My name is Maureen, and I became a stroke survivor at the age of 38. I began experiencing lightheadedness and dizziness starting around 2006. During a doctor's visit, I found out I had an irregular heartbeat. I was referred to a cardiologist. After many tests, I learned that I experienced a TIA, or a mini stroke. I recall waking up with a massive migraine. I would fall asleep and wake up periodically, a bit confused and dazed. When my husband checked on me, he noticed I was slurring my words, and I brushed him off, blaming it on the migraine. Several hours later, my speech got worse, and my migraine was out of control. My husband convinced me to go to the emergency room. Just after our arrival at the hospital, I lost all physical mobility on my right side and suffered an ischemic stroke. I remained at the hospital for 34 days, undergoing physical, occupational, and speech therapy. I regained most of my speech. I was able to get dressed all by myself, but it would take a very long time. I was even able to walk, with the exception of dragging my right foot. I continued with outpatient physical therapy and was determined to walk normal again. I had surgery on my ankle to stretch out my tendons. Sometimes I use a brace, which is fitted from my waist down, as I continue to have problems with spasticity. I take anticoagulants for my atrial fibrillation. I made this decision after asking my healthcare team a lot of questions and doing my own research. Today, I embrace my new life after stroke. I treasure the time spent with my husband, our kids, and grandchildren. As a stroke survivor myself, I want other stroke survivors to know that you must be your advocate and your road to recovery. Remember to celebrate all accomplishments, no matter how big or small. Learn more about the AFib Stroke Collection at myafib.org and stroke.org/afib-stroke.
So that is just an example of someone younger in her 30s who had a stroke due to her having the atrial fibrillation. And then any questions for
Yeah.
Maria or
Any questions you guys may have?
So I have a question. With her having that atrial fluid at that young age, did she have any other history? Do you know?
Well, it says at the beginning she had dizziness for a few years prior. But besides that, I mean, it's hard to tell if she did or not. But the only symptoms she notes in her story is that she had dizziness, which is one of the symptoms Maria went over.
And it lasted those few years before anything ever
Happened.
Yeah, I mean, who knows? She may have had blood pressure. You know what I mean? We don't have her backstory, so that's the thing.
there was a sign there.
Yeah.
Sometimes there's no signs, right?
Yeah, I mean, usually you'll feel something, like Maria said, but honestly, dizziness is one of those hard things anyways, because a lot of people have experienced dizziness, and sometimes the AFib is hard to catch. Someone might come in and out of it. So that's one.
We've had a lot of patients that we've tested where you go, wait a minute, and I mean, even from one capture of the EKG to like just a few minutes later, you're like, wait, that's totally different. You know what I mean? And like, we're trying to catch it, and you think like, okay, this person is going in and out of it. So it's not a permanent thing to see.
Any other questions? Well, thank you guys so much for joining us, and later today I will send out an article as well. Not all of you go to clinics, but some of you go to clinics. We can share them with our clinics just to promote the AFib Awareness Month. And then hopefully a lot of you will be joining us because it's also Hunger Action Month in September. So we are volunteering at the North Texas Food Bank on Saturday. So I hope to see many of you there. And if you are signed up, please see me before you go because I have your shirts. And lunch is on its way. So let me go check my phone and see if Rita's here yet. Thank you.
Thank you.
Yeah, I'll probably read it.